Hey everyone, it seems like every other week I'm getting a question, or we are getting a question in the Thriving Urology Practice Facebook group regarding bioidentical hormones such as Testopel or testosterone pellets. It could be the medication, the administration, sourcing, or something like the use of trocars. What kind of trocars and where do you guys get the trocars? So when a rep from a compounding pharmacy reached out to try to join the Thriving Urology Practice Facebook group, I said, you know what? We don't allow vendors, but I'd be happy to host you and have you talk about what you all do and what you all offer, and maybe you can provide some information to our members. And I'm very, very happy to have someone from Qualgen. Her name is Nikki Good, and she is going to bring us some information and value regarding compounding and what's the difference between a 503A versus 503B, and her company's line of products, a little bit about her background, and maybe answer any questions that you all may have regarding compounding and compounding pharmacy. So welcome to the program, Nikki. Thank you so much for joining us. Okay, if you can, somebody asked in the questions, let's see, I want to make sure. Okay, somebody asked in the questions regarding compounding pharmacy, what's the difference between, somebody wanted to order from a 503B versus a 503A, and there's apparently some benefits. Would you mind quickly going over that?
Sure. The biggest benefit to 503B versus a 503A is the fact that we are not patient specific, meaning the physicians who have a DEA, we can ship in bulk to their address. So that means you can have unlimited supply of pellets on the shelf for any patient that you might want to dose in the future. The other thing is the fact that we follow strict GMP practice, so good manufacturing processes. So the FDA kind of holds us to a stricter guideline than they do the 503As. We are not patient specific like the 503As. Um, you know, we get the FDA comes in, the DEA comes in, Oklahoma Board of Pharmacy comes in. They all do inspections of our facilities and they make sure that we are doing as we need to do to adhere to their guidelines that they put out.
So in essence, a 503B can bulk sale to a
Yes.
physician's practice. Now, speaking of bulk sale, there's some people may misunderstand. Say, if I have a large practice with multiple locations, and one person, obviously you have to ship to one person, right? And you can't ship to any old location where they're administering, like, say, testosterone pellets. How
Right.
can you kind of explain that a little bit, because some people may be confused?
Sure, we have a lot of doctors that have several different locations, and we can only ship to the location that we have a DEA number on file for. The other thing is there's still certain states that are new to the 503B getting used to it. Like California, we're still not in California. We are working really hard to get there, but as many other 503Bs have found, it's extremely difficult. I think we will have it in the next 6 months. So there are certain states we can't ship to. And if you don't have a DEA for that specific address where your clinic is located, we cannot ship to that clinic. So we have to go to exactly where the DEA address specifies.
Okay, so if you have a large group, you can ship it to whoever holds the DEA license. You can only ship to that one location. And I know Qualgen is located in Oklahoma, and just in the form of disclosure to everybody, I am not a customer of Qualgen. I have no financial relationship with Qualgen, and this is just simply a service for Qualgen and for the members of the Thriving Urology Practice Facebook group. You said you can't ship to California yet. What are some of the states larger states, if you will, where you can't ship currently?
Right. So we have 6 states that we cannot ship to currently. Um, South Carolina, Alabama, Arkansas, California, New York, and Wisconsin. And they're random, but it's just the rules. Every year, the states change the rules with 503Bs because they are so new. And so one year somebody may not have any licensing rules out there for us to do, and the next year we have to jump through 10,000 hoops to be in that state. So it's constantly changing. Everybody's learning more and more about 503Bs and what we do and how we do it and the advantages of using 503Bs.
Okay, so let's get right into the most important, the most commonly asked question about testosterone pellets. Tell me what you all offer and how easy is it for, like, say, a practice to order from you guys?
It's extremely easy. We just have an application form that needs to be signed by the clinic physician or mid-level practitioner with the DEA number, and then we can ship directly to the office. Normally, we can set up that account and ship out the same day if it's before like 4:30 p.m. Central Standard Time. Our dosages, when it comes to urology clinics, you're going to probably do 100% men or close to it. A lot of them, maybe some fewer women, but the dosages that you guys would use would be our bigger dosages. The one most common that we have is the 87.5, and that's more comparable to the 75 milligram Testapel pellet, which most urologists are familiar with. We are different in that we cannot offer a 75 milligram pellet because of the fact that Testapel does that one. So in compounding, we have to do different strengths. So ours are testosterone, we have 12.5, 25, 50, 87.5, 100, and 200 milligram. Those are all made with a excipient, which is stearic acid. They're 99.5% pure pellets. And then we do offer a 200 milligram slash 20 milligram anastrozole in case somebody needs that blocker, that testosterone blocker in there. And then we also offer a 200 milligram testosterone pellet, which is made with cholesterol instead of stearic acid, just because we have certain physicians that were adamant on having cholesterol in the pellet. And that's the only one we make like that.
Okay, some of the members also asked about topical type of, as like say 200 milligram testosterone cream. Do you guys
Right. We
offer?
do not do any creams. We do 200 milligrams per mil to 10 mil bottles of testosterone cypionate. And that's the only other product that we're offering at this time other than pellets. We are looking to bring others on, but we are a small company. We've been in operation for 7 years now, and we wanted to make sure that we felt like we perfected the pellet before we moved on to other items. So we're growing. We start out with about 5 people, and we're up to about 40 now. So, we continue to grow, and as we do, we'll continue to add more products that you might use in a urology clinic.
Okay, sounds good. So we cover ordering, lead time, and ordering can be done via the phone or via portal, or how does that work?
Some people email them in, some people fax them in still, amazingly enough. We have an online ordering portal that is extremely easy that people can just go into once their account is set up, and they can order directly. They can call us. There's just no limit of whatever works for the clinic practice, what works for us. So we want to make it as simple as possible.
Pigeon, pony, however you
That's
can
right.
get it. However you can
Fly
get
it
it.
over with a carrier pigeon.
Yeah.
We don't care.
Okay. Well, sounds good. And you already said that you guys follow GMCP guidelines, so it's scrutinized by the FDA every single step with the medication, anything that you guys produce. It's good that you guys are concentrating on a small line of products and doing that really, really well before you expand. I know one of your competitors is called Wells RX. Is that correct?
Yes.
That's what.
Wells, and all the pellet companies out there, we can't say anything bad about anybody because they all do phenomenal jobs and they all offer pellets that are good pellets. We do know that ours is the purest, and that's why we specify ours are the purest pellets on the market. I will say too that we follow USP guidelines as well. So.
Okay, yeah, very good. And I don't use Wells either, so I don't really know about their product. Or so if you are a small company competing with, I assume Wells is larger. I don't really know.
They are. I think we're the smallest out there. And they've been doing it longer than we have, but we all came on to the 503B at the same time. So they were making pellets as 503As. We were the first registered 503B pellet company. So if you go look at the FDA registering outsourcing facility website, so we were the first 503B that was registered.
Nice.
Yeah, it's
Yeah.
fun.
So you guys have, yeah, a lot more experience in that regard. So
Well,
if,
yeah, I mean they've been making them longer, but I feel like we've really perfected what we do.
but as a 503B, yeah.
Yes. Yeah.
Now, as I have a lot of empathy for the smaller companies as a solo practice urologist. I'm a dying breed. And so I'm trying to share my knowledge with other practices so they can thrive and survive like I have. And so there's always that brand differentiator. What is your brand differentiator compared to the other compounding pharmacies? What are you doing differently than other people that
Well, I
sets you
think
apart?
the thing that we always hear is customer service because in working with patients, if they don't like who they deal with, they will go elsewhere. So it's very important to us that we make sure that our clients are happy day in and day out, and our sales reps work extremely hard to make sure that everybody's taken care of in a timely manner, that they're happy with the product they get, that it's shipped um, correctly, and that there's no problems with it. And we work really well with, if there's something that they get and an item has something wrong with it, then we will replace it. I just feel like 100% it's our customer service above our product. I feel like we have the best product, but I also feel like we have superior customer service. So,
Well, that is certainly important and definitely a very easy way. In the urology realm, in the medical realm, in my opinion, when everybody's doing it so poorly, it is easy to stand out. I don't know how it is in the compounding pharmacy space, but in medicine, urology included, it's very easy to stand out when you do something, especially customer service, better than anybody else. And
yeah.
things are super simple, like actually answering the phone with a person instead of a machine. I know sometimes that may be difficult for larger practices. They have to employ or utilize interactive voice response systems. But if you think about it yourself, you as a customer, would you like to talk to a person, solve your problem, or do
Right.
you want to talk to a machine and try to, one method is convenient for the company and the other method is convenient for the customer. And I think for any company to win, you always want to be empathetic to your customers.
Absolutely. And that's what I push with my sales reps. It's like I want, you make them your friend. You get to know them. I mean, if we know that, a lady that answers the phone that we generally that does the ordering is having a baby, we'll send a gift. I mean, we want to know people, we want to know our customers, and we want them to know that they're important to us because without them we fail.
Yeah.
So that's where we come in. It's like we succeed because you guys are successful.
Yeah, it's truly all about relationships.
Yes, absolutely.
Okay, somebody raised a question, I think just this past week regarding testosterone pellets, these trocar kits that
Mhm.
may be needed. Now it comes in a couple of different varieties, right? One is just single use and the other is reusable. Tell us more about where we can get these trocar kits and where do you guys
You
source
can
them?
order them directly from us. We ship them out. We work with a couple of different companies. So you will have your reusable ones that you guys can autoclave in your practices, and you can get those in stainless steel or titanium. And then you would just have the other articles that you might need, like your sterile gloves and your drapes and your lidocaine and stuff to complete your process or your procedure. We also have disposable stainless steel that just has a stainless steel tip. We have the beveled edge and the diamond tip on those. And then we have the completely plastic disposables. The kits that you get will have the drape, the gloves, the syringe, the cup for you to put the pellets. They'll have everything you need in a sterile kit that's shipped to you, and you just open it up and it's ready to use, which is extremely convenient for your assistants, your medical assistants that are getting the procedure set up. They come in the 4.5 and the 3.2. The 3.2 are for those smaller pellets, and the 4.5 trocars are for the male, the 200 milligram trocars, the 200 milligram pellets, excuse me.
Okay, so can you clarify that a little bit? 3.2 millimeters are for what
All of
dose?
our pellets up to and not including the 200 milligram. 200 milligram pellets require what we call the male trocar, which is the 4.5. So we refer to them as the male trocar and the female trocar just because most men use 200 milligram pellets and then everybody else uses the smaller pellets, so the 3.2.
Got it. So pretty much 4.5 for the 200 milligrams, and everything
Yes.
else is 3.2
Yes.
millimeters.
Yeah.
That makes it easy for anyone who's listening. And for those of you who are watching, feel free to put in your questions in the comments, and I'm sure Nikki will be happy to answer them.
Yes.
And I will try to bring those questions to her if you guys are watching this on a replay. And I will also include her contact information if you are interested in the video description. Anything else that you guys do at Qualgen? I know you guys are located in Oklahoma. It's kind of nice. You can ship to either coast pretty conveniently.
We can. We're very centrally located, so we can get most everything shipped out. We do a lot of 2-day, which just seems more economical and quicker for our clients. Most of our practices, we advise right now with COVID, shipping is always tricky because, everything's being shipped right now. So you may need it overnight, but it may not get there overnight. And it's not of any fault of ours getting it there. It's just UPS, FedEx, they're just running a tad slower than they normally do. So we advise people when you're going to order, ahead of time, if you know the people that you have coming in for a procedure, to try to get those on the shelf, a few days ahead of that appointment time.
Sounds good. Well, no, now you can certainly compete with others on customer service. What about pricing?
Well, we will meet pricing that anybody has, but I feel like our pricing has always been very competitive. But we're not going to lose a client because of pricing, and that's always been kind of our deal. It's like, we used to be about $25 for a T200, which in comparison to the Testapel 75 milligram, that seems really cheap. I know. So, you can get a lot of product for a little amount of money.
Well, being price competitive is certainly a good thing. So
Yes.
we'll see what you can do for the members of the Thriving Urology Practice Facebook group who may be.
Absolutely. And they just need to call us and discuss it because we have a scale too. Like if you order a bunch versus 2 or 3, we have a little more room to play with the pricing on those.
Volume discounts, of course. Can you go over
Yes.
maybe one or two, a couple of commonly asked questions or misconceptions or things that you have to answer over and over in your company that you think the members of the Thriving Urology Practice Facebook group would probably benefit from?
Well, I think the biggest thing that that we know that physicians ask all the time is um, just, is your pellet better than everybody else's pellet? And I can't tell you that my pellet is any better than anybody else's pellet. I can tell you that we have clients that have been with us since day one. We've had a few that have left and they've came back because the test results, the lab results that you get with our pellets are just better and they're consistent. And I think consistency is the big word with our pellets. It's like, what you're getting. We have not changed. I can't say that. The only process that we've changed in making our pellets since we opened the doors has been switching from autoclave sterilization to the e-beam sterilization. So all of our pellets go to Steritech, which is a company that we send them to, where they are e-beamed. So we have 100% confidence that those pellets are sterile before they ever get to you. So we also have, we did send everything to PBL, but we are almost to the point where we can do parametric release, which means there'll just be, a batch or a lot number here and there that will get sent to PBL, and we'll do in-house testing going forward. because we've had just superior results with our pellets thus far.
And certainly the purity of your pellets probably plays a role in the consistency of the end result on the patient's serum testosterone levels, possibly.
Yes, absolutely. We know that. I mean, that's what doctors want. They want consistency. You don't want to be all over the place, especially with hormone levels. So, and I think now I feel like people are needing them more than ever. We were talking, we did a podcast a few weeks ago with a physician, and he said he just knows with people going through all the anxiety and stuff of the COVID, that he feels like hormones and getting them on track is of utmost importance.
Well, sounds good. I know initially the OBs started doing bioidentical hormone replacement therapy, and then it seems like every corner fly-by-night operator and a lot of medical clinics, including urology practices, are jumping on the bandwagon.
Right. And one thing I do want to stress is learn how, get somebody in to train you. If you're not doing pellets yet and you're interested in bringing pellets into your practice, get trained. And we have people that we can refer you to. We have people that we can refer for dosing because we cannot tell you how to dose. I do know there are doctors that go, oh, I watched a YouTube video. I know how to do it. I'm like, I strongly advise against that. But, I can't tell people what to do, but I would strongly advise that you get trained by a professional that knows what they're doing.
Well, that's good that you guys at least have some resources for referral.
Yes.
So we covered the pellets, we covered the ordering, we covered the quality, the purity, and also the trocars. I don't know if there's anything else that we can cover other than
I can't think of anything.
what I'll do is I'll include your contact information, Qualgen's link in the video description, and I will share that with the members of the Thriving Urology Practice Facebook group. Any parting words, Nikki?
No, I just so appreciate you guys having us on. I know that you guys we are beginning to see more and more urology practices come on board. And, we had a good time at the AUA and hoping that maybe we can meet up with a lot of people at the next one that we attend.
Okay, the next one I think is going to be, I can't remember if it's September or July, but it'll be in Vegas, so it'll be a lot of fun.
Oh, yay. We love Vegas. We go to the AMMG and the A4M there every year. So we're excited. We're ready to go back to conferences and meet people again.
Well, very good. Nikki, thank you so much for coming on and sharing your knowledge. And I hope some members will contact you and maybe do a little bit of price comparison if they already use another pharmacy and possibly try you guys out.
Thank you so much for having me.
All right. So if you guys have any questions or comments, leave them below, and I will put every Qualgen's contact information and Nikki's contact information in the video description. Thank you all so much for watching. Have a great rest of the weekend.